as the title of our session suggests, we're going to be highlighting the progress and challenges that we faced in trying to mainstream gender in the implementation of the Sendai framework for disaster risk reduction, especially within a European context. I think this year has been very interesting for all of us, both on a personal level, but also in terms of our work, when we look at the impact that the COVID emergency has had on just about everybody's life. And one of the very important things that's been highlighted is that we have still a long way to go in addressing the risks faced by women and other gender groups, even within a European context, where, you know, the general impression is that we're perhaps a little more immune to gender disaggregated risk. So without further ado, I'd like to introduce Maureen Fordham, who is one of the leading voices on gender and disaster risk. And Maureen will be moderating our session today, and she'll be introducing our eminent speakers for the afternoon. So Maureen, over to you.
Thank you, Zara. And welcome everybody, and thank you for coming to this what looks to be a very interesting session. We're exploring gender mainstreaming and the implementation of the Sendai framework for disaster risk reduction. And we have three speakers with us today. Our fourth speaker, Claire Hutchinson, unfortunately has a family emergency and can't come today. And that gives our three speakers just a little extra time. So I think Zara has already given this broad overview. We don't want to take up too much of your time. We want to hear the speakers, but just to remind everybody that today is actually the International Day for the Elimination of Violence Against Women. So any of you wearing orange, I got a little bit of orange on me, not much, to support the UN Women's Day. Okay, over to the speakers then. So we have three speakers, and they have around 7 minutes or so each to explore these topics. And the three speakers are Katrine Van Der Hayden. She's a sociologist and a gender and climate consultant. We have Olga Janaeva from Kyrgyzstan, and she's director of the Alga Rural Women's Association and leader for Action Coalition on Climate Justice. And we have Ilan Kelman, who's professor of disasters and health at University College London. So I'm going to begin with our first speaker, and that's Katrine Van Der Hayden. The broad topic for Katrine is around the gender dimensions of climate risk in Europe. So Katrine, I know you did a study of flooding in Belgium earlier this year. So maybe that might come into your talk now as you address some of these issues. Over to you. Thank you.
Thank you very much. Welcome, everybody, and thank you very much for having me on the panel. So indeed, in July, Belgium was flooded, the south of Belgium, some valleys, because it's quite a hilly area. And some of these valleys were severely flooded due to heavy rainfall that lasted for a couple of days. The weather system had gotten stuck above that place, wasn't moving anymore, so all of the water fell in that place. And very often when I talk to people around me about climate change, too often people in global north countries, like, you know, the whole of Europe, we tend to think that it's something for global south countries and they will be the victims and bear the brunt of it. And then we say, oh, well, that's just very sad for them, but what can we do? And I think these floodings were a wake-up call to the people in Belgium to start realizing that climate change is a real thing, and that it can also lead to disasters happening where we live, in our own villages, and strike in our own street, in our own house. And it really brought home that message. Now, as a gender expert specialized in climate and gender, I was very curious to find out all of those things that we read about the connection between gender and disasters. Would that also apply to this case in Belgium, where we really have a nice example of a global north disaster happening? And so I went to the area, I spoke to victims, I read newspaper articles about it, and I tried to gather as much data as I could. So luckily only 38 people died, or I could say, unfortunately, 38 people died, because that's a lot of people. And one of the first things that I can confirm, we often say that women and girls are really victimized more severely by disasters than men and boys. And in many ways, I can confirm that for the situation in the south of Belgium, because indeed there was a very interesting intersectionality that I found between women, poverty, and age. Let me explain. So the poorest people live down in the valleys close to the river in the center of the villages, because these are the cheap houses. The richer people, they live up on the hills, and they have a villa overlooking the neighboring hills with a very wide view, which is really beautiful. So what we saw is that, of course, the flooding happens next to the river in the valley, in the base of the valley, and that's where the poor people live. So that's one of the first things that I really saw, which is in line with what we expect with a lot of other disasters happening, that the poorest people are hardest hit because they live in the lowlands where cheaper housing is found. But we also found a connection with age, that a lot of the female victims were older women, often that they had moved down from the hills to the center of the village as they grew older to be close to the shops, etc., after their husband died, because on average women live longer than men in Belgium. And so there were quite a number of these stories, and I thought it was very interesting to see how time and again all these things that have been written so many times in reports about the link between gender and disaster and the specific vulnerabilities of women, especially senior women, especially women living in poverty, that again, this is replicated in this instance. However, there was one very interesting find. Among the 38 people who died, there were 20 men. And this is something not to be expected, because very often we see that there is a higher number of women dying in disasters than men. So I looked into that, and I looked at the cause of that, and I found some very interesting notion that has to do with the concept of masculinity and how our culture defines masculinity, and we call it the first responder phenomenon. So boys grow up with the message that if a disaster strikes, they have to save the day. They have to be the hero. They have to be the Superman. It's like the captain is the last one to leave the ship. And so what I found in the accounts, the specific accounts of the men who died, is that very often they died not because they were at the place of disaster, but that they went in there to save other people because they felt that that was their task to do that. And many of these men were older men themselves, had never taken a training on how to do rescue operations, and therefore they put their own lives at a huge risk and died. Many of the women who died is because they were struck inside the house that was flooded, but many of the men died because they came in as a first responder. And so that is a very interesting to look at, because I think, if we want to really tackle problems that have to do with gender and climate, we have to look as much as the masculinity side as we look at the femininity side. Now, other things that I think link this disaster to, for example, the COVID disaster, because that's also something, how can you link flooding and a pandemic, are there similarities? I've been thinking about that as well. And some of the links that I found is that, again, also in the disaster here, in both disasters, I think the contribution made by women is often rendered invisible. So in the newspaper articles after the flooding, we found that men were hailed as heroes, and there was a lot of attention given to the rescue operations done by men, whereas women had set up in the villages after they were struck beautiful projects of solidarity, helping each other out, and they were hardly ever mentioned. I only found out about this project by talking to the victims themselves. So women doing the brunt of the work is often the case also here, but they don't gain anything economically. They're supposed to do it completely for free. and they don't get any recognition. And exactly the same thing I found with regards to COVID in Belgium. You know, women are the ones sewing the mouth mask when we were out of them, sewing the protective gear when we were out them, and everybody expected them to do that for free and to just hand it over to the hospitals around them. While it is mainly men, you know, being in charge in pharmaceutical companies who are developing the vaccines, but nobody expects them to hand them out for free. We're willing to pay for them. So the economic angles of what we expect the specific gender roles to take up as a role in disasters is also very stereotypical. Now, one last element that I want to say, because I can see my time is almost up, is that when we talk about reconstruction afterwards in these disasters, both COVID and the flooding in the south of Belgium, a very interesting concept that I've came across is that we need to build forward and not build back, because we don't want to go back to the old world. First of all, because it's not possible. Things have profoundly changed. We need climate adaptation. We need to change the way we live and how we structure our communities, where we build buildings. So it's wrong to tell people now that they can just go back to normal. And the same with COVID. We have to restructure our world and start taking this pandemic as a long-term thing. It means that we can't build back, but we have to build forward. And that creates a fantastic opportunity to get rid of all these gender stereotypes. But we can only do that if we are aware of them. And if in all the plans of reconstruction, we take this deeply into account in all of the aspects. And I will hold it now. I've got much more to say, but we have some more time afterwards.
Thank you very much, Katrine. And picking up on your point about masculinities and the hero role, it's also worth exploring the work of Deborah Parkinson and Claire Zara in Australia on bushfires and precisely around that. Now our second speaker then. So I'd like to welcome Olga Janaeva. And Olga, we'd really be interested to hear your perspective from a civil society perspective on building resilience to disasters and how you engender disaster risk reduction in the European context. You have 7 minutes. Thank you.
Thank you so much, Maureen, and hello to everyone. So it's my great pleasure to be at the same time in the village and at the so high political forum. Kyrgyzstan, I'm based in Kyrgyzstan, Central Asia. And Kyrgyzstan is a mountainous country, and the glaciers are the main source of water here. Melting glaciers due to climate change and multiple environmental degradation lead to the scarcity of water for agriculture and farming. Unfavorable differences in the night and day temperatures, together with the drought, are causing big risk as well. And also there are 92 uranium tailing storages in the country, which are very vulnerable to natural disasters. And it's a great danger, not only for Kyrgyzstan, but for the whole Central Asian region. And more than 60% of the population lives in rural area. Women in rural communities are very much dependent of water and energy resources to sustain their livelihoods, family and food security. Pollution of air and water resources, loss of biodiversity, land degradation and loss of pastures. This environmental crisis exacerbates economic and the social vulnerability of women. And many of climate changes projected are likely disproportionately affect the poorest groups in the society. In Kyrgyzstan, there is an evidence that women, especially poor rural women, are most likely to be affected by flash flooding and landslide, as they spend much more time in exposed residential and subsistence production area. Climate-related disasters have impacted women and communities in many areas, including agricultural production, food security, water management, and public health. The level of impact and the coping strategies depends heavily on their socio-economic status, socio-cultural norms, access to resources, poverty, as well as gender. So effects are not gender neutral, as women and the children are among the highest risk groups. And the key factors that account for the differences between men's and women's vulnerability to climate-related disaster risks include gender-based differences in time use, access to assets and credits, treatment by formal institutions which can constrain women's opportunities, limited access to policy discussions and decision-making, and the lack of sex disaggregated data for policy change. So at the national level, we have this, like all the policies and documents in place. We also ratified the Sendai Framework Convention for Disaster Risk Reduction. So there are attempts to integrate the gender in the national action plans, but when we shall apply to the local level, to the grassroots level, so there is almost no awareness about all of these political processes and very low awareness on the framework, and like we have only some pilot project for integration of Sendai framework goals and objectives. And these are only 2 communities in the south of the country. In this context, founded and driven by rural and grassroots women of Kyrgyzstan, ALGA, Rural Women's Association, is advancing rural women's leadership, participation, resilience, and capacity building through several key action areas. By supporting grassroots women with capacity building and training and sharing of information systems and technologies for enhancing and leveraging the capacity of women and girls to build resilience to climate and disaster risks and to mitigate climate change, advanced transitions towards a green regenerative economy by supporting capacity building, particularly around energy transition and gender-just energy solutions. And due to the impact of climate change, agricultural production reduces drastically, leading to high food prices and food insecurity. And agriculture still remains the most important employment sector for women in Kyrgyzstan. But despite of all the hardships, especially during COVID-19 pandemic, women and girls are not just victims of these circumstances. They are leaders of transformative change. They display extraordinary resilience and create innovative and transformative solutions. Indigenous and rural women use ancestral knowledge and practices to build resilience in a changing climate. For example, by preserving crop biodiversity and seed varieties, protecting pollinators and local bee population, using natural soil buildings and fertilization methods, leaving forests intact and other. And also they try to apply affordable technologies like construction of a solar heater, solar dryers for fruits and vegetables, construction of some equipment for struggling with air pollution. So they organize like community awareness campaign and advocacy campaign at the national, regional, and even international levels. But still women and girls are also missing from climate decision-making processes, including at the local and municipal level, due to lack of information and capacity to engage in such processes. And I'm sure that we must implement the actions and commitments that lift up the invaluable expertise of Indigenous and rural women by enabling them to access climate planning processes, starting at the rural level, where they have the best knowledge for how to manage resources sustainably. And the women's-led programs and initiatives for creation of some early warning systems and to build maybe stronger infrastructure and some initiative to strengthen their resilience must be supported and enhanced to ensure women and local communities become resilient and can adapt and can manage this disaster risk. So that's just in short. Thank you so much, and I would be happy to answer your questions. Thank you, Maureen.
Thank you, Olga. And thank you for introducing this important aspect of the gap really with grassroots groups who unfortunately often are left out of the loop. Okay, I just give a heads up to the audience. Please have your questions ready, because after our next speaker, then we will open up to questions from the floor. So please start to ask your questions. So our third speaker then is now Professor Ilan Kelman. And the broad topic for Ilan to consider is particularly around disaggregated data, but also using evidence-based decision-making. So Ilan, 7 minutes, thank you.
So thank you so much. And the real question is, how do we do it? But that's been answered already. Do what Katrine did for Belgium, and then learn from Olga in terms of what this means in practice and how science is used. Because those are the two lessons which we need regarding disaggregated data and evidence-based practice for dealing with disasters. Involve scientists much more, but also ensure that scientists understand the practical needs and how to communicate to a wide range of people involved, including disaster-affected people. In terms of involving scientists more in your work and what's needed, we have the techniques as scientists. It's our job to understand data, to design, to sample, to collect, to record, and then analyze and interpret. And we often have competent and eager students willing to assist us and you as part of the degrees. So ask us and involve us, such as one fundamental lesson we will say again and again, that we do not use the phrase natural disaster, because disasters come from people's decisions and choices. Disasters do not come from the water or the rain or the earthquake. They do not come from nature, and they are not natural. So we will say, when we're looking at the data and when we're trying to understand how to implement it, just call them disasters. Do not use the phrase natural disaster. Keeping in mind that, well, scientists are not always the best communicators, are we? And we often have intense bureaucracy to navigate, which delays our work. Some of it is legitimate, certainly such as research ethics, because when dealing with disaster-affected people, no study and no data collection should cause more problems. Who is going to approach a bereaved parent and ask, I'm curious, with what gender did your child identify, and did they have any disabilities? Although that may be a fair and legitimate question, and some people respond positively. They often want to tell their stories about their loved ones. They want to get that information available, but not always. So it is tricky to navigate, and we must do it properly. Some scientists are trained therapists, trained rescuers, and trained medical workers. Others are not, which means that any research on disaster fatalities can take time, and it must be completed ethically. It can be done without collecting data directly. We do not have to be in the disaster zone. Anonymized databases are sometimes available of everyone killed, or death certificates are accessible for research, which may or may not be public, but sometimes they are actually public. One example in which I was involved was after Hurricane Katrina in the US in 2005. A number of people evacuated from New Orleans and elsewhere in Louisiana to Harris County in the Houston area in Texas, and several of them died directly attributed to Hurricane Katrina. The medical examiner put anonymized data of every fatality online, and they updated it regularly. So I went through that and watched them updating it and saw that 2 of the Katrina fatalities were 0 years old. When I investigated this, it turned out that 2 women who died were pregnant, and this being Southern US, a fetus is the same as a person. And so 2 pregnant women dying means that 4 people were killed. This shows how even counting bodies and ages and genders and other such variables, simply the number, can be an ideological decision. None of this is straightforward, and we need you on board to help us sort through the issues where we offer science. I did, in fact, come up with one piece trying to summarize the difficulties of counting the disaster dead, identifying 13 factors inhibiting not just disaggregated data collection, but simply the whole notion of consistent and verifiable data on the numbers of people who die in a disaster, which in turn poses difficulties for evidence-based decision-making, particularly when we want gender responsive, disability responsive, age responsive, risk reduction, basically intersectionality responsive or inclusive responsive, inclusivity responsive disaster risk reduction. What we can as scientists do very well at is identifying and analyzing actual and possible errors and limitations. What do we know? What don't we know? And this is about communication. If a scientist tells you that the data are perfect and gives the answer, then you might want to find a different scientist. More commonly, we are too hesitant. Might, could be, likely, a possible trend under some circumstances. When the decision maker just wants the answer and you just need to know, what does it mean? So work with us. We are human beings, even if some scientists think they are deities, and it is working together to understand your needs, what we can and cannot provide, and together collaborating to answer these questions regarding gender, age, disability, and more for disaster, and ultimately apply our knowledge, our evidence to produce our wisdom to save lives and help society. Thank you.
Thank you, Ilan. So we've got the solutions, we've got the people, but often we're not asked or we're not included. We've got the data out there, maybe, but do we have the quality data, or do we just have a lot of data? I don't see any questions arriving yet, so I'm going to remind you all to, in the audience, to give us some questions. Otherwise, we will continue talking for the rest of the day about what we want to talk about. But in looking back at what has already been addressed, intersectionality, that problematic term, has cropped up several times. But I think what we're looking at here is a much bigger view of gender. And all of the speakers have addressed it in different ways, whether it's to do with making sure that you're actually thinking about men as well as women, or whether you're also thinking about age and other aspects. I wonder if the speakers would like to extend that discussion a little bit and think about this whole issue in relation to implementing the Sendai framework and what needs to be happening. If you would like to elaborate a little bit more, because you didn't have very much time, on some of the challenges around broadening our understanding of gender and capturing it in data. If anyone would like to start on that.
Thank you. I see Ilan also raised his hand, but a millisecond behind me. So Ilan, if you excuse me, I'll go first and then you can join in. Well, there is one thing that I didn't talk about, and I think it's a very important concept when we think about moving forward, and that's accountability. And you know, we often say the world was made by man for man, when it comes to, you know, how cities are built and how societies are built, and they hold power positions. But also when we talk about climate change, for example, and the link with CO2, it's clear that man holds the power positions in fossil fuel industries and all of that. And I found, when talking to the victims in the disaster in the south of Belgium, it was very interesting when I asked them, do you feel, you know, there was a lot of anger being there, a lot of anger. And when I asked them about it, they all were looking for someone to blame, to hold accountable. And very often it would be the guy, the technician at the dam upriver, because he should have opened all the valves of the dam way ahead. And definitely that is one element that is contributing, but there's many others. And very often I could see that people had a hard time looking at the whole picture, because there's also abuse of agricultural land that contributes to such disasters, not just the guy at the dam, but they wanted the guy at the dam because that's easy. It's a person, he has a face, they can blame him. And so when it comes to holding men accountable, because very often behind these faces, it's men being in power positions, having taken decisions which are wrong. I think so little work has been done on that. How can we hold these men accountable without making all of the other aspects invisible, but including all of the aspects that contribute to the disasters that happen, and in a way that it is not just to blame an individual, because after all, the guy is just doing his work and probably following orders as well, but holding ourselves as a whole society accountable and seeing how we can heal from that, because that's very important. If we want to break down the gender stereotypes and the power structures attached to it that lead to the wrong decisions that lead to the disasters, you know, then we have to trace the whole chain back and dare to hold people accountable and hold all aspects accountable, and see how we as a community are accountable, and how wrong power structures and chains of command, which are often hyper-masculine, contribute to this, and try to change that. So that's one more thing that I was thinking about. But I'll hand over to Ilan now.
Thank you, Katrine. Ilan.
No, excellent. I mean, what we have to do practically is use the words and the definitions. So we know that there is sex, we know there's gender, we know there's sexuality, and people will identify and be in different ways. So the Sendai framework goes some way towards that. What we do know is that other international agreements maybe not, such as the Sustainable Development Goals, which don't even mention non-heterosexuals. So many cultures, many countries have different approaches. They have different aspects, particularly of sexuality and gender within their culture, and admitting those and dealing with people on their own terms is then how we can ensure that vulnerabilities on these bases are reduced. So it really comes back to people and respecting what they want for themselves and the constructive aspects of their culture, because not all gender or sex or sexuality-based aspects of culture are to be promoted, such as, for example, female genital mutilation. We also need to be cautious of stereotypes, such as in the UK, when after the Grenfell high-rise burned, killing over 70 people, it was actually the male opposition leader who was seen as having a compassionate human response, and the female prime minister who was seen as forgetting about the people. Even when Margaret Thatcher was prime minister, she was known for being so opportunistic about visiting disaster survivors in hospital that people started selling a postcard like an organ donor card saying, if I'm hospitalized after disaster, please do not let Margaret Thatcher visit me. So ultimately, it comes down to being human. We all have human characteristics. We all have differences. And so how can we learn, respect, admit, and acknowledge when we are looking at these issues of not just post-disaster, but especially prevention pre-disaster?
Thank you, Ilan. I don't know if you'd like to come in, Olga, on that one.
Yes. Thank you, Maureen. When speaking about gender and gender mainstreaming, for civil society, and especially for women's organizations, it's like a great upset, maybe that still there is like a struggling and contradictions in the society that they do not recognize that gender existed, gender disparities, and even among our academicians and researchers and scientists. So especially when we speak about climate change and disaster risks, so they do not recognize that there are like gender specificity and the gender issues. And so it's a very deep question and issue that we really need like a deeper analysis. And in this regard, I would support Ilan's that and Katrine that really we need very much of this evidence-based gender disaggregated data. And in this regard, there is still a big gap, like in our country, and I think that in other Central Asian countries as well. But at the same time, we see that during disasters, all of this gender inequalities, discriminations, they exacerbate, and they reveal this all like patriarchal traditions and norms that still exist and even flourishing in our country, and I would say that in all Central Asian countries, and it is an issue not just for one country, but we need to build this regional dialogue and cooperation and solidarity. Because when solving some problem in one country, so without cooperating with the other country, like on the issue of water management and the water, like a very serious resource, and even it can be a cause of conflict, and so disasters created by conflict is also very familiar for our region as well. And so it's a pity that we still need to prove that there are gender dimensions, and we need to integrate gender. We need to hear voices of different group of society, not only women, but I agree with Ilan, but men and youth. So that to consider all of these needs and the priorities in our national plans, and especially the plans of the local governments, because life is there, like, and we need to create all possible protective measures and resilience at the grassroots, at local levels, and so I see it like that.
Thank you, Olga. I think you raised some, you've all raised some important issues there. And I think although we have gender identified in the Sendai framework to an extent, the session is very much about the challenges around implementation. And I think there's the gap between policy and implementation, very high level policy frameworks. And then how then do you get the implementation right down at the grassroots level? I can see Katrine's hand up on that one.
Yes, thank you. Unfortunately, I can't bring you much good news there, because I've been involved in a lot of gender mainstreaming work, and what I find on a governmental level is that very often, there is really resistance to have the lessons learned. We know what the problems are, we know how we can solve it, but to really completely implement this into all the policies and strategic plans seems to remain a huge challenge. And definitely in the case of Belgium, one of the biggest problems is that the political responsibilities are so fragmented among many ministries. So the Minister of Energy is somebody else than Agriculture, is somebody else than Disaster, somebody else than Internal Affairs. And in the end, all of them would need to contribute if you really want to do a comprehensive prevention of such disasters happening again. And it's really very hard to get that sense of we are faced with wicked problems which are very complex, nuanced, and touching very many aspects, but the political responsibilities are hugely fragmented, and you end up with a situation where everyone is competent but nobody feels responsible, and they all leave it to the others to do it. That's one of the first resistances that I find. Also, I think a lot of the messages that we bear are very uncomfortable to hear, because they all point out to a deep-rooted structural inequality which still happens in our society between men and women, between rich and poor people, and they point towards the much-needed system change that we all talk about often. But the implications and the realization that we really need that system change are often too huge and painful to realize, and people want to steer away from that. So in reality, what I often find is that gender mainstreaming risks being just some greenwashing measures with regards to gender, picking some low-hanging fruits, doing the obvious things, but not really moving towards a comprehensive policy plans which are needed. It almost sounds as if the structures of our governments are not yet fully equipped and prepared to deal with huge wicked problems like we are facing on a global scale today. And then one of those problems is that they overlook the importance of getting boys and men on board with gender equality and disaster and all of that, and all of these aspects need to be thought of.
Thank you, Katrine. And in fact, you just made a perfect link for us to one of the questions that's just come up, which is how can the lessons learned from COVID-19 provide a basis for stronger and more effective engagement with gender needs in disasters and ending violence against women and girls in particular? Would anybody like to start? Ilan's hand up first.
Thank you. I mean, excellent question, highly pertinent, but sadly, not much new is coming out of COVID-19. We have known this long before. Look at Maureen's work. Look at what Katrine presented. Look at Olga's work. The lessons should have been implemented long before COVID-19. There is so much which we knew before, which could be now. So what is different? How can we do differently? And in a sense, the answer, and trying to be positive about it, which I think we can and should be, very much goes back to Maureen's question also. How do we implement? Well, listen to Olga. She's doing it. There's success there. My UCL colleague, Karina Fernley, is in Portugal today. She founded and directs the UCL Warning Research Center. Part of what we are trying to do is ensure disaggregation and inclusivity for gender, age, disability, and more. So rather than the question being, well, how should others be implementing it? It's about how should we be implementing it? What can we do? And don't take no for an answer. So we're a long, long way from the end of the COVID-19 pandemic. We are still living with the HIV/AIDS pandemic. We have many other concerns, whether it's the floods in Belgium or British Columbia or Kerala, whether it's an earthquake which could hit Portugal any day, whether it's the whole realm of long-term chronic disasters such as poverty, human trafficking, and drug use. And yes, we have to bring gender, age, disability, and others into it, which means it's up to us. Another good example is the organizer of this session, Zara Zaidi, who is a scientist, and yet who is doing it, implementing it when she does her consultancy work, but taking scientific lessons. So who's going to do it? We're going to do it. How do we take the lessons from COVID-19 and do better? Well, let's take the lessons from the past 100 years and do better to ensure people are involved, they are not marginalized. We do not accept violence of any kind, gender-based or otherwise, and actually move forward to say, this is about disaster risk reduction, but well beyond. It's about a healthy, safe planet with humanity in which everyone is involved and everyone is contributing.
Thank you, Ilan. Do the others want to come in on the COVID questions, the lessons learned from, or not, from COVID?
May I?
Olga.
For me, is one of the lessons learned after COVID and during COVID, that the role of the civil society. We see that during this time when, so it was like a great stress, not only for the population, but for the government also. So the great gaps revealed, and civil society, even community groups, they managed to bring this first aid and support and to fill in those gaps that government was not able to bring to people who was suffering, who were dying, and especially to women. So it was really a nightmare, like last year, especially during the summertime, with the gaps in our health system, in the gaps in our educational system. And so civil society, they bring their volunteer groups, their like contributions to help people. So for me, like we need to build this collaboration with cooperation with government structures, and they should not, I would say, be afraid of the civil society, because we try to bring like positive change, and we are all very much interested in the progressive developments and to realization of human rights of all groups of people. But these lessons learned is is not taken into account. We see this shrinking space for civil society and limited like spaces for the democracy and for freedom of association and freedom of like expressing. So it's like in this regard, we need to build this international solidarity and international power and like multilateral cooperation. I would not say multi-stakeholder, but a really multilateral cooperation. And we need this understanding that really, like, we live on one earth, and so now these boundaries are very much conditional. Like, if something happened in one country, it would easily happen in other countries as well. So we need to join our efforts to save and to prevent all of these disasters. And so,
thank you. Yes, the artificiality of boundaries, political and administrative boundaries, and the need for solidarity that crosses those boundaries. Katrine, I see your hand up.
Yes, I wanted to say, for me, there are some positive lessons learned when it comes to the COVID pandemic. I think it did bring the world closer together, because we were all faced with the same problem and in different waves. But, you know, there was there was this notion of us humanity on this planet facing this huge problem. I also think a good positive lessons learned is that in most society, people started to listen to scientists much better than they had before, or on other topics like climate, often scientists would be ignored. But now all of a sudden, we had scientists in the news every evening, and I think that's a positive lesson. And I think a third one is that it showed that people are actually in the possibility of very quickly making profound changes in the way of life. All of a sudden starting telework, for example. I've been advocating that as a gender expert to so many organizations for so many years, decades already. And they kept on telling me that it was difficult to organize, et cetera, et cetera. And all of a sudden, within 2 weeks, everybody was completely set up to do it. So it shows that we can change, that we can profoundly change, that we can do it quickly, that we can do it scientifically based, and that it even increases the solidarity between us as humanity. And I think these are 3 very positive things that came out of it. But of course, there's a but at the end of that sentence, and that's that I had to realize I had high hopes in the beginning that it would also profoundly change our relationship with work and paid labor versus unpaid labor, which is so problematic and problematically influenced by gender stereotypes. And we could only conclude at the end of the day that that didn't happen. So the women who bear the brunt of the unpaid work continue to do that, despite the fact that often both partners would be working from home. Often the husband would get the nice office and the wife would sit in the living room with 3 kids around her. So we just sort of continue to replicate these things. And that's such a pity and a missed opportunity. So for me, I think that remains a huge challenge. How can we tackle these gender stereotypes reproducing themselves in the midst of a huge change that we achieved to do. And that is still a very big challenge, I think.
And thank you, Katrine. I just wonder if if gender mainstreaming is the route to some of the changes that we are suggesting in this discussion. The title is around progress and challenges in gender mainstreaming. So if we take the spotlight off the gender bit, but to see it particularly around mainstreaming and the role of gender mainstreaming in bringing about policy change and implementation on the ground. Ilan, I can see your hand up.
No, that's the key question. And we are all aware of the debates that when you have a topic, do you separate it out, give it its own name, its own department, and its own idea, or do you integrate it everywhere so that everyone thinks about it? And in a sense, it's a balance, it's both. What's intriguing about gender is that we all have one. So gender is already mainstreamed into our society, which means it's a bit peculiar that we don't bring it into our policies and practices. So in a sense, it's perhaps not so much gender mainstreaming per se, but why don't we admit, accept, and acknowledge that sex, gender, sexuality, and more exists, and therefore stop suppressing the inclusion of it, but recognize that we are human beings and we have to bring our humanity to the policies and practices. Maybe, to be provocative, so unusual for me, it's about mainstreaming humanity and humanism.
Thank you, Ilan. Yeah, Katrine, you had your hand up. Olga, it looks like you're about to come in afterwards. We're running out of time, so just a few quick comments from you both. Thank you.
If I can go first, I think I'll be very quick. I think gender mainstreaming only works if we are focused. And that means that we have a very clear goal where we want to work towards. And very often that lacks. It's not in the vision of the ministers who develop their policies. They don't have that gender equality goal in front of them. And so, they just meander around it. So a very clear focus and linking it to system change, the willingness to really go for all in and towards the system change. That's the only way I think gender mainstreaming will ever work.
Thank you. Olga, did you want to say something about
Yes, just some quick remarks. So I think that we all need to wear gender lens so that to see all this hidden discrimination, and we need to do all our best to achieve not only gender equality, gender equity, but gender justice. So, and then everybody will be happy, I think, and we can solve many problems of our time. Thank you so much.
Gender justice, solidarity, intersectionality, so opening up that box that says gender and thinking about it much more broadly. I think those are some of the things that are being talked about, but there is still, it seems, a challenge to making them happen on the ground. They may creep into higher policy levels, but the difficulty is implementing right the way down to the grassroots. I think we are soon running out of time. Rather than me summing up, I wonder if you, the three speakers, would just like a minute to provide us with your takeaway point. You know, what kind of headline point would you like to leave this discussion with? We'll go in order again of how the speakers started. So Katrine, do you have a headline point that you would like to leave us with?
Well, I do like the close collaboration between scientists and gender experts. I think that's crucially important. And saying that, I think a big takeaway is the realization that we can only tackle these problems with multidisciplinarity, and you know, being aware of all of these aspects together and trying to tackle them. And we have to find ways of doing that as a humanity, because we haven't. We've, you know, the way we operate is being fragmented, and we need to get that together.
Thank you. Olga, did you have any more to add? I mean, you already actually gave a perfect ending, really, but maybe you want to add. I
completely agree with Katrine and Ilan. So we really need to have this comprehensive, integrated approach, and we need to change minds, and not to change like climate or nature. And so we need changes in all of the system, in our education, in our science, culture, communication, information. So it's really a very broad question. But so my great takeaway that we really need more such spaces where we can meet and exchange and share from different regions, and to find like common solutions and the way forward, and also challenges and how to overcome them.
Thank you. Ilan, did you want a last word?
Please tell us what science and scientists can offer. We want to help. We are here to help. We have so much that we can help with, but it's an exchange. It has to be on your terms, particularly because we are human beings. And you, I hope, are also human beings. So whenever we are doing our work, whether mainstreaming, disaggregation, evidence-based, whatever we call it, we are doing this for human beings as human beings.
Thank you, Ilan. So we've kind of moved from nature-based solutions to human-based solutions, to keep considering humanity in the round, in all its diversity. I'd like to thank all the speakers for some very stimulating discussions today. Also, of course, to thank UN Women and UN DRR and the European Framework for Disaster Risk Reduction also for allowing us this time to discuss these issues. It seems one of the things coming out is the lack of trust, the lack of use of social science, or even to recognize the social as a science. So we really need to have an equal playing field for gender and all of the other social characteristics alongside what people typically think of when they hear the word science. So thank you, everybody. And I think we're out of time and we have to say goodbye now. Thank you.